I now call the August 3rd, 2023 Senior Citizens Advisory Board meeting to order. Has this meeting been properly noticed and posted in compliance with the Nevada Open Meeting Law?
Yes, it has.
Thank you. Would the Deputy City Clerk call the roll, please?
Chair Arier Cameron.
Present.
Vice Chair Weinstein Hall.
Present.
Member Padaretu.
Present.
Member Galati.
Present.
Member Mosdeen.
Present.
Member Drum.
Present.
Member Lee.
Present.
Member Graham. Present. Thank you.
Thank you, Deputy City Clerk. Item number 3, public comment. Comment during this portion of the agenda must be limited to matters on the agenda for action. If you wish to be heard, come forward and give your name for the record. The amount of discussion, as well as the amount of time any single speaker is allowed, may be limited. Seeing and hearing none. Item number 4, for possible action to approve the final minutes by reference of the special meeting of June 1st, 2023. Is that correct date?
I want to say June 3rd. Let me take a look.
I don't think that's, it was it? Okay.
Yep.
Okay. Do I have a motion or any amendments?
Member Mosdeen, I move that we accept the minutes as written for the June 1st special meeting.
Thank you. All in favor?
Yes.
Aye.
Yes.
Any opposed? Item number 5, presentation by Jocelyn Blewett-Fisher, Community Resources Manager, and Lindy Cooksey, Senior Outreach Specialist, Department of Neighborhood Services, regarding the Health and Wellness Initiative.
Good morning, or good afternoon, everyone. I am Jocelyn Blewett-Fisher from Department of Neighborhood Services, and I am the new manager for Health and Wellness for the City of Las Vegas. So just want to give you guys a brief overview of what health and wellness will entail. We do have a strategic plan that once it's approved will be presented to all of you, but as of right now, it's sort of all in development. But we do have some general ideas about where we're going with health and wellness. We are looking to create programs and services that address physical health, mental health, as well as the social determinants of health. Usually when someone is having a mental health crisis, or if they're ignoring their physical health, it's because there are other things that are happening in their life that they are not able to pay attention to. So if you are having a toothache, but you have to go to work and you need to earn money for your family, most likely you're going to go to work and not go to the dentist. So by addressing some of those social determinants of health, making sure that people have access to fresh fruits and vegetables and food, making sure that people are rent stable, making sure that we're addressing any other instabilities that are happening in their communities and their neighborhoods, we will also be able to improve health outcomes for some of our neighborhoods. So some of the highlights of what we will be doing is that we have contracted with a consultant called Consilience, and they will be taking us through a community countywide exercise in trying to develop a system of care that will address underserved communities as well as the homeless. What we're finding in our work is that we have a lot of great programs that are addressing healthcare for the homeless, but there is no complete system that links everything together. So while we have some homeless individuals who are still using the emergency rooms, we'd like to start connecting more people to medical homes through some of our federally qualified health centers. We'd like to be able to engage community health workers to help them navigate the healthcare system. We'd also like to make sure that there is follow-up care, because if I show up at the ER and someone gives me a bunch of prescriptions and then I'm turned back out to the street, how do I continue my healthcare journey and how do I continue with follow-up care? We are also looking to increase access to health care in some of our underserved communities by creating new federally qualified health centers. So far we have opened 2. So we have one that is open on Wardell and Bonanza, which is near Bonanza and Mojave. It's connected to one of our Strong Start academies. We are opening one on August 14th that will be located on the corner of Main Street and Formaster, and that will be operated by Nevada Health Centers. And then we have 2 centers under development right now. One will be built on Jackson Street in historic West Las Vegas, and one will be built on Bonanza and Lamb in a lot that the city has newly acquired. The goal is to create a system of 10 new healthcare centers in various neighborhoods around the community. So as we are doing research in various communities, finding out what their community healthcare needs are, we're identifying plots of land that we can purchase as a city and then building from there. The different thing about our health and wellness centers as opposed to a traditional clinic is we want to create spaces that people feel comfortable in before they get sick. So they have an opportunity to come through the doors for education and workshop and classes so they can learn about their health, so we don't wait until someone gets sick and then expect them to come in to see the doctor. If we can build those relationships with healthcare professionals and make it a more community-based space, then hopefully people will feel more comfortable talking to their doctor because maybe I just did yoga with my nurse practitioner 2 weeks before and now I have a cold and I can disclose information because we have that kind of relationship. So the Jackson Street Clinic is slated to include things like a chronic disease institute, a maternal child health support center, a cancer support center, so that there are other things, and a learning kitchen, so that we can again start to incorporate health and nutrition into our wellness centers, and it's not just a place that you come in when you feel sick. Also trying to design spaces that feel comfortable. We don't want them to be very sterile and very clinical, because that again is foreboding, and I might not want to come inside if it feels like it's this cold clinical space. So incorporating things that are warm colors, green space on the inside of buildings, so that they are these places for wellness and not just for clinical health care. As far as mental health is concerned, we are looking at partnerships with the state of Nevada to support the 988 system. So I don't know if you all are aware, but there was legislation that was passed for 988, which is the number you should call if you're having a mental health crisis instead of calling 911. The 911 system and 988 should be linked together, so if someone calls 911, they'll still get routed over to 988. But by calling this system, you'll get a outreach team that will come out that will be able to assess your situation and possibly de-escalate. We don't need everyone who's having a mental health emergency coming to the emergency room. Everyone who's having a mental health crisis does not need to go on a 72-hour hold. We don't need chemical restraints on people just because they're having some sort of crisis. In some situation, there's a way to de-escalate the situation, reroute them away from the emergency rooms, and then connect them to the mental health care services that they need that don't involve an emergency room. So 988 and this system is a part of what we're working with the state on trying to develop for here in Southern Nevada. Any questions about anything so far? Yes.
Does Metro, in other words, if Metro is present, will they call 988, or what would they do? In other words, if whoever is in need doesn't.
Excellent question. So the goal is to keep law enforcement and fire and rescue away from calls that they really don't need to be involved or engaged in. Because if it's not someone that is violent or someone who's a danger to themselves or a danger to others, bringing out that law enforcement call to action sometimes escalates the situation instead of de-escalating the situation. So by going through 988, these outreach teams that are a part of this system will respond to the call instead of Metro.
Okay, again, my question is, if they're present and the person doesn't know about 988, are they knowledgeable enough to say, hey, maybe you should have called 988 and we'll step back rather than do something else,
Right.
proceed?
I get it. The goal is for all the systems to work together. So Metro is at the table for these conversations. Clark County Fire and Rescue, City of Las Vegas Fire and Rescue, all of the emergency services are a part of this system that the state is building.
Thank you.
Mm-hmm. Yes, ma'am.
I'm Elizabeth Petrato. Is there any system you are planning to implement in urgent care or emergency room to reroute these patients, clients who's coming in with non-emergent and guide them to the appropriate places? Like we have talking about different.
Yes. So our goal is to make sure that there is access to quality health care in the various areas so that people aren't using the ER as their healthcare system. But it's not something I think we'll ever be able to end 100%. We are having conversations with the hospitals about what does that look like. If someone shows up at the hospital and they really don't need emergent care, where are they referred to and how does that happen and what does that look like, which could be a combination of a referral and an appointment to a healthcare provider. It could be community health workers that are there in the ER that can then have those conversations and try to reroute people into different systems and services. All of that is still being worked out, and that'll be a part of the system of care work that we're doing with Consilience.
Is there going to be regular intervention/information classes or events people can walk in and get some awareness of where they are or what can they expect? Any of these facilities are giving any classes or something like that instead of they wait until they get sick and walk in their community?
That is exactly the goal of our wellness centers, is to have those classes and workshops and engagement activities that are available to the community. And we know that if we build it, people will not come. So we know that if every time we build a center, there has to be a very robust engagement strategy attached to that. So for example, the clinic that is opening on August 14th on Main Street in Fort Master, we will still have our outreach team there at the Courtyard Homeless Resource Center, our street med team, that will be going out not only to the clients and patients that are there at the courtyard, but they work with Catholic Charities, with Salvation Army. They'll go out on the street to talk to people, engage with them, and then do one of three things. If it's something that they can triage and treat as a street outreach team, they will take care of it, always with the foundation of trying to connect them back to the clinic for their medical home. If it's something that is severe and emergent, then they will call 911 because that person needs to get to the emergency room, or if they're a good candidate for our recuperative care center, making those referrals as well. So we are constantly trying to figure out how we can engage the community and bring them into our centers instead of expecting them to know that we exist. In addition to serving the homeless population, the Main Street Clinic will also be working with and serving the low-income housing that's all around the Main Street and Fort Master area, because we do have a lot of low-income families and seniors that are in that area that will need access to quality health care as well.
Thank you so much.
Yvette Weinstein Hall, I have a question. At the various emergency rooms around the city of Las Vegas, up in Summerlin, or up, all the other hospitals, are the staff then going to be trained as to how that for them to be able to call 911? Are they going to have educational classes so that the emergency room is not filled up with these people?
That would be our plan. As we develop the system of care, the hospital groups will absolutely be a part of those conversations so that we can not only include them on how the plan will work, but get their input on how the plan will work.
Okay, thank you.
You're welcome.
Deanna Rear Cameron, first of all, thank you. This has been so necessary and needed, and having a strategic plan is the first step, and I love hearing about this plan. I love the talk about bringing in all of the community partners and working together, and I completely understand that that means we're doing our part as the city, and of course there's going to be all these legs going out, and then it's going to take them doing their part, which we do not have control of. I want to make sure that goes on the record for people who may be listening to this later. But I love that we have a plan in place, that we're going to be also proactive with what you said, the education, wellness, and workshops. And on that note, I'm going to ask the really big question, and that is, how can we as a board help get that information out when we are out in our individual wards or in the community as a whole?
Thank you for that question, because that segues into the next part of what I wanted to talk to this board about is some of the things that are falling under the Health and Wellness Initiative, in addition to all of the things I just discussed, is also the work of the Senior Advisory Board and also the work of our Veterans Advisory Board. Really, for this body, the most important role that I see for all of you all is to listen. We need you in the community talking to other seniors and then bringing information back to us to tell us what are their needs, what are their hopes and dreams, so that as we are implementing programs and services, we can make sure that we are on target and we're not just guessing in the dark. For example, there is a group who is interested in doing workshops and classes to educate seniors on how to navigate healthcare in this day and age of electronic health records and apps. for me, that sounds like a great opportunity, but that doesn't necessarily mean that it's something that seniors would be interested in or would even participate in and want. So as opportunities come up, we want to be able to match opportunities with the need. So one of the things that we would like to start doing and instituting in these meetings is we can set up a large board in the back of the room with Post-it notes. And if there are issues or topics or things that you have come across in your conversations with seniors in your wards, we want you to write those topics down and then stick them on the board. And then once a quarter, we will gather all that information and then come back to you and say, here's what we're hearing you're talking about, and here are some things that we can do as a board or as neighborhood services to try to address those needs or educate people on these particular issues. But your feedback and your information based on what you're hearing as you're talking to the seniors in your area is vital to any of this process.
Charles Lee, Ward 5. On your Jackson Street project, is there any plans for a pharmacy?
Yes, it will have a pharmacy.
Okay.
Vito Galati, Ward 2. I was just wondering whether, again, I brought up this, the library system to disseminate information seniors, because they do have programs here and there. I was wondering whether that would be a good venue to, because I know it's very difficult in Ward 2 to really reach out to the seniors. It's either, it's hard. Most of them will not attend certain meetings, but they do go to the library, and they do have special programs. I know one of it does, the senior scam one at the Sahara West Library, and I was wondering, something relating to their health, I think would be very appealing also.
I think outreach will look different in everyone's ward. In your ward, if that is where seniors are going for their information, then yes, then that would be a great outlet, not only for us to provide information, but for you to be present there and get information from the seniors. But it might look different. Someone else might have community centers that are very active. Someone else might have a senior club that's a part of a HOA. We're looking for any and all opportunities to be able to engage with seniors, but we need that feedback from you all.
Thank you.
Nicole Graham with Ward 1. Question on the mental health, is that also, I guess knowing those diagnoses or diseases are going to be overlooked, but is that also possibly going to include dementia, Alzheimer's? I know a lot of those behaviors sometimes are misguided, that it's a mental illness, and maybe it is more of the dementia, Alzheimer's that they're experiencing. So just curious what that may look like.
Right, and I'm going to lean on Lindy a little bit to give me some background on this, but Alzheimer's and mental health are treated differently, whereas Alzheimer's is considered physical health, and other mental health diagnoses that deal with chemical imbalances in the brain are treated separately. So if there are Alzheimer's related things, it would probably fall more under our physical health umbrella than under the mental health umbrella. That doesn't mean that we won't still look to do things. If there's a need, if there is education that we need to provide, if there are workshops and services or newsletters or speakers or any of those things, we are open to all of that. We just, again, need your feedback.
Deanna Rear Cameron, and to that note, I think maybe even adding in the education the signs of what the difference is if it is a cognitive disorder in an early stage onset would be good, because as Nicole mentioned, she and I both have been in the industry a long time, face to face with seniors, and sometimes it does look like it's just a mental behavior. But it turns out they have early onset. So I think that might be too what she's addressing is, so if we're seeing this and we're addressing this, how I guess what is the guidelines that somebody would know the difference, and then obviously give a referral. So and educate everybody involved in this process so that they know the difference, because I know there can be a fine line.
Absolutely. And so if this body is looking for a campaign that provides information on warning signs of Alzheimer's, or when it's time to go to the doctor, or what is not normal just getting older sorts of things, maybe that's something that we pursue. There are a million opportunities and ways for us to get the information out to the community, but I'd like to tailor it to what people actually need and not just what Jocelyn thinks, because my opinion is not that important.
Yvette Weinstein Hall. The Lou Ruvo Center is downtown. The issue is how would you get some of these people there? Because they deal with early onset Alzheimer's, and they have clinics and they have programs all the time. I see that through the OLLI program for seniors that I attend, and I've been and attended some of those, not for my own. I don't have the Alzheimer's, thank goodness, but just to provide information to the seniors. But again, it's transportation issues.
And so that could be a challenge that this body takes on, to talk about what transportation looks like, or maybe reaching out to see if some of those classes and workshops can be mobile, if it's something that can be provided in an alternative location outside of the Lou Ruvo Center. We're open to having all of those conversations.
Okay, thank you.
Deanna Rear Cameron. So I do know that there are a lot of resources already on the cognitive side, and obviously mental health is a huge concern here. Literally just came off my Commission on Aging meeting where that was a big subject, and we are going to be doing some focus groups, so I will be in touch with you.
Absolutely.
And I think what the main concern, like what Nicole and I were on the same page on, is just making sure that everyone involved, including the general public, understands the difference, because one of the things I see with some of the families is they'll just automatically think someone's in cognitive decline when it can be, a mental health situation, or vice versa. So that's kind of, where I do understand the drastic need for mental health services.
Or in some cases, a nutrition deficiency that hasn't been addressed. So just knowing what those warning signs are and knowing when to go to the doctor is huge and important in this work and in this space. And so not just for health and wellness, but really just for seniors overall, for their overall well-being. As you're out having conversations with seniors in your ward, as you're attending your classes and your workshops, if you're talking to people in the grocery store, if there are issues or concerns or things that people are talking about, we want to know about it. If it's a concern for someone in Ward 3, it's probably a concern for someone in Ward 4 as well. So if we can start putting those on Post-it notes in the back of the room, and then have those conversations about what we have in common, and then what this body would like to take on as a challenge to address, we can really start to move the needle, and at least at a very minimum get more information out to the public so that they know what resources exist in their community.
Does anyone else have any questions? Thank you so much. We really greatly appreciate it. We definitely have been looking for direction, and knowing what your plan is helps us to better know when we start strategizing ourselves for our next steps. So thank you very much.
You're very welcome. Thank you for your time.
Item number 6, abeyance item, discussion for possible action regarding priorities for the Senior Services Strategic Outreach Plan, all wards. So, Deanna Rear Cameron, for me, hearing this information and a lot of information that I just soaked in myself this morning, I'm not really, I think, myself in a place, because I know the first things I'm going to say are always the same: housing, food, prescriptions, and healthcare. Those are the number one things that come through for me. So those are always going to be, priorities in my mind, because that's what I hear the most. But this is our item where we can discuss. It does not mean that we actually have to do an action today, I think I understand, but if we want to have some more discussion towards it, because we have all been consuming a lot of information between the courtyard tour and our meeting and then today's presentation. Does anybody have any?
Yvette Weinstein Hall. I think that the presentation that was made today is really what we need to focus on, quite frankly. And I'm very happy that we had the attendance of that individual. So I agree with you, Chairman. Thank you.
Does anyone else have any other discussion?
Can I?
Caroline, would you like to speak, Jocelyn?
Sorry.
No, that's quite all right.
Jocelyn Blewett-Fisher, Department of Neighborhood Services, City of Las Vegas. When we talk about the challenges and topics that we want to tackle, housing is huge. So when we say housing, what does that mean and what does that look like? And how does that apply specifically to seniors? Are we talking about housing subsidies because of rent increases? Are we talking about home health care so that more seniors are able to age in place? Housing is just a very, very big topic. So we'd like to whittle that down a little bit to say what specific topics under the umbrella of housing exist and how that impacts our seniors.
Chair O'Rear Cameron. So for me, to narrow it down is actually difficult because I have to say all the above with everything I see. But one of the direct needs is, you know, these rent increases are so high, and then with the cost of everything going up, including food and, you know, healthcare, although we do have some new things that were passed that are going to help, I think that's one of the first things to address, because we're literally pricing all of our retirees right out of an area that's known for being a retirement place to go to. So that's one of the first things I would see. And then also, you know, being able to age in place so that they don't have to go, whatever that means. It could mean any level of care. But really just the rising costs, because I know the calls I get, and I'm pretty sure Gregory can attest to it too, are always these rent increases. You know, it's getting hard. They get a new lease, and all of a sudden, I mean, like myself, I'm over 55, and I'm getting yet another $200 increase. And I've been getting that every year. And so I think that's a huge part of the problem, because a lot of them are on fixed income, and their income, even if it's a retired income, it's still fixed. And so they've planned and based on that. And now with all these costs going up, and, you know, housing is the #1 basic need. So it seems to me that that's one of the huge places to address, and the others are all a priority as well. But if we could do something with that somehow, and that could come from other programs. Once again, my discussions earlier today were on that too. When you start taking care of, you know, these other ones you just mentioned, you free up money for those increases. So they all kind of meld together. But for me right now, the calls I get all the time are these increases. It's very difficult when you're on fixed incomes.
Absolutely. So when we're talking about topics that we want to address, I want to be granular, not very general, because a housing challenge might look different for me than for you. And so if we can start kind of ticking those boxes of what all falls under housing, it makes it easier for us to strategize around what specific topics we want to try to do education around or find resources for, or any of those things.
Caroline Mosdeen from Ward 6. First of all, thank you very much, Jocelyn. I actually look forward to reviewing your presentation on the audio, because you had so many wonderful points and such great information, so I would like to thank you for that. And as far as Deanne, every point you made is, as usual, is excellent and on point. The only thing that I would add is something that was touched on earlier, which is transportation. I keep leaning towards transportation, and it's only because we have so many wonderful programs. I see it in my ward. We just can't get people to the programs, even as simple as they might be. Daytime programs, people that are actually even mobile, but we can't seem to kind of corral them in order to get together to share this information with them. And we're going to be talking more on a granular level ourselves, but there are many things that we as a board can't really do, but that you're out there doing. And I kind of see us in many ways as a conduit for information in both directions. And that's why I very much appreciate your thought about the Post-it notes, because those are the kinds of things that we really can do on a regular basis. Even if we touch a small group of people, we still have that opportunity to hear what they have to say and see what areas are important to them, and to stress to them that it's not only them, but their friends, their relatives. So there's quite a bit there. And there's one other area which I don't even know if this is totally appropriate, but in my community, we have several people who love their homes, can keep up their homes to a large degree, but they're actually looking for someone to be a roommate, to rent a room to. So I'm not sure when we get to this granular level if there is a way that we can possibly find ways to not necessarily pair people up, but to spread that information that there can be a home, there can be an actual room in a house that would help two people at the same time. So, I'd like to kind of focus on that as well in the future. So again, thank you very, very much. And thank you to Lindsay back there, because she is great. She has helped us out in more ways than I can share today. Thank you.
Yeah. And because the Senior Advisory Board falls under Health and Wellness, Lindy and I will still be working closely with Greg, so you'll be seeing more of us at your meetings and have more engaging conversation, and really try to get these strategies a little bit of a lift so that we can start making some movement on some of these issues and challenges. So not the last time you'll see this face, I hope that's okay, but we do plan to be a part of the work that you all are doing moving forward. When we are doing our strategies and we're picking our topics, it might not be something that we can solve or make a huge dent in, but as an advisory board, this is your role, is to advise the city and to advise our council offices on what you're seeing, what's happening in your community, what seniors are concerned about, so that as they're making these larger decisions about what happens with city dollars and programs and ordinances and all of those things, they have a little bit more information because you have advised them on what you're hearing and what you're seeing. So will we solve the housing issue? Maybe not. But will we be able to give some definitive information on what we're seeing and what we're hearing from the seniors we're talking with? Absolutely. And that should influence the decisions a lot.
Deanna Weir Cameron, so I would say what I'm hearing is data and information, and that comes from us doing what we can in the community to get more of that information, and
Absolutely.
Also refer people to the care line so that you get more of that information.
Yes.
Okay, I want to make sure that I'm hearing it correctly for all of us.
Yes, all of the above. And we're saying data and information. There's numbers and then there's anecdotes. The anecdotal data is just as important as the hard data and the numbers, because the conversation that you're going to have with someone in the grocery store is gold, because it's unscripted, it is them talking about what's going on with them, and that's important. Because I might not be a part of a survey, or I might not be ticked as a part of a data and statistic because I didn't participate in this particular service. But it doesn't mean my concerns are any less important or valid. So as you're out in the community talking to people and engaging with people, that is the information that we need brought back as well.
Thank you. We so appreciate you. Does anyone else have any discussion that they would like to bring forth regarding priorities for our Senior Services Strategic Outreach Plan? Item number 7, report by Gregory Gray, Management Analyst 1, Department of Neighborhood Services regarding senior issues received by the Department of Neighborhood Services, all wards.
Gregory Gray, Department of Neighborhood Services. So speaking of our care line, 702-229-1200 for the record. We've been getting a number of calls from our senior community. We've been dealing with like some seniors that are facing or are concerned about friends or neighbors experiencing elder abuse. We've also been educating some seniors on what elder abuse actually is. It's not always physical, it is isolation, it is financial exploitation. We are encouraging seniors that feel that, that they or someone they know are experiencing elder abuse to call Adult Protective Services to get a social worker to come out and see how they are doing. When it comes to some of these services, I want to make sure that the board, as well as our senior community, is, aware of, that we can only help you if you allow us to help you. You have to consent to services. So while the concern may be, my friend is in danger, I'm concerned about their well-being, let me call Adult Protective Services, let me call the police, it's very imperative that we are informing that senior that they need to be able to speak up and advocate for themselves, say, yes, I am in trouble, yes, I feel like I'm in danger, I need your assistance, I need help in this situation. That has been a common thing that we've been dealing with when it comes to all senior services, not just elder abuse, where consent and understanding and awareness are very important to receiving those services. We've been dealing with seniors that are dealing with mental decline, families that are trying to support their senior family members that are dealing with mental crisis or dealing with Alzheimer's or dementia, and how to best navigate that. And there's a misconception of what that care looks like. And it takes a level, and it comes down to consent. Even if they are experiencing mental decline, if they are in a lucid state and they're able to consent or decline services, that is their right. So if a family is concerned about a particular senior family member that is dealing with mental decline, but they are not necessarily making the choices that are in their best interest, then they would be at the family's discretion whether they want to establish power of attorney or guardianship, and that would basically take some consultation with legal services such as Legal Aid Center, Southern Nevada, Senior Law Project. So we're trying to make sure that families are aware of the resources that are available to them to help them make a well-informed decision on these life choices regarding the seniors and their families. We've been getting a number of calls regarding seniors and utility bill increases or housing repairs. We've been referring a number of seniors to Rebuilding Together. I have talked about this with our chair, and while Rebuilding Together is always on hand to help our seniors and our disabled persons deal with living in place, aging in place, and making sure that they are living in a happy, healthy home, funds are limited and services do change as those funds diminish. So we try to be as mindful as we can when it comes to referring seniors and making sure that they are aware of the services that are available to them when it comes to repairs and services. We've been getting a number of calls from outside the city of Las Vegas. We received a call from Overton and Logandale as well as Arizona in regards to seniors that are living in those particular places that are dealing with these issues, as well as relatives that are living in those areas that are concerned about their senior family members here in Las Vegas. So as these changes occur in the senior community, it's not just within the city, it's being felt outside the city as well as cities outside of Las Vegas. We've also been receiving some calls as well from our mayor and council offices concerned about housing, evictions, rental increases, rental assistance programs that are available to seniors and the public at large. We are doing our best to address those as best we can. Resources are limited, funding is limited, staffing is limited to be able to assist those individuals. We are referring them the best way we know how. I was having a conversation with Member Galati about, educating seniors on equal pay programs and, knowing how to contact Nevada Energy about an energy assessment, making sure your house is properly weatherized to keep your air conditioner from running all day to keep your house cool because it's not ventilated properly. So I say all that to circle back to what my manager, Jocelyn Blue-Fisher, was referring to, that there are several opportunities that are available to the board as well as senior services to be able to educate and reach out to the community at large. So when we talk about, seniors that are dealing with Alzheimer's and dementia and the family support that is needed for them to age in place, that sounds like an educational opportunity that we can pursue. We have an outreach team that is available to us to help us coordinate those outreach events. We have connections with our community partners to be able to come in and talk about those issues at hand. There was, Member Mosdeen brought up roommate matching or roommate pairing services. The county is currently working on a pilot program for shared housing. So we can actually have someone come in and speak about that particular issue and possibly do more outreach to educate the community on what shared housing looks like, what the criteria is, and how that works. Sorry, I'm just reviewing my notes. Bear with me just a moment. Jocelyn did mention that housing is a very large topic to tackle, and she did mention things like subsidy, home health care, and ways to offset the costs to be able to age in place. Shared housing may be an opportunity for that, being mindful of how to engage with your utilities. When it comes to housing, and in particular, I know that we had one particular senior who was unable to afford to live in the area that she is living in. And while we are on hand to assist that senior and recommend what would probably be best for her to age in place or to downsize to offset the cost of living here in Las Vegas, it all still comes down to a matter of consent. We can recommend all day. That particular case, the senior wanted to continue living where she was even though she couldn't afford to live there. We have connected her with the shared housing program, so we're hoping that we will see a good outcome when it comes to that particular situation. But I wish it was as, cut and dry. We recommend you services and resources and you accept it and you're able to do what you need to do and be comfortable. But we also deal with the reality that people, especially our seniors, are set in their ways and they feel a sense of entitlement to where they're living or what they're dealing with, and they expect the response to be in kind. So just keeping all of that at the forefront of our radars and how we move accordingly. And that's all I have to report at this time.
I have a question. On the shared housing, as a little light went on, and I remember we had a discussion maybe 3-4 years ago, and one of the questions I think at the time was whether there was an agency or some sort of way that would assure, at least give a reassurance to anyone who wanted to get into that situation. Do we have, does the city have anything of the sort?
Gregory Gray, for the record, the city does not have a shared housing program, but we are in support with the county. So we are meeting with them on a regular basis to guide them. So you are correct. We did have a presentation about shared housing, I think it was like 3-4 years ago, and we passed that information along to the county because they have the capacity to do that program where the city could not. So in response to that, we are supporting them in their efforts, and we will see about getting the representative from the agency that is currently running that program to come and do a presentation for the board.
Thank you.
Yvette Weinstein-Hall, I have a question, Gregory. Isolation. And isolation is all-encompassing. It also deals with elder abuse because people are isolated, and you have domineering children that want to step in and take over. Also, isolation when people get phone calls and fraud. And we've had workshops about fraud happening, telephone calls. People, older people tend to get bamboozled into giving money or that they don't even have. So it all goes down to isolation, separation, and that's a major issue that this panel has to, our board through the city has to address. I've been to numerous seminars that Ward 2 and other wards that they do present seminars regarding this isolation and fraud. The problem is that a lot of people don't come to those things. And here we again go back to transportation. Okay, thank you. Appreciate it. Thank you. I appreciate what you're doing, Greg. Thank you.
Thank you. Cameron, I will save some of the things that I'm going to talk about what Gregory just did for my ward report for the sake of time. Now we have item 8, report by board members regarding senior issues and events within their council wards and at large, all wards. And for Ward 1, we have Nicole Graham.
Hello. For Ward 1, Nicole Graham with Ward 1. In regards to senior issues or events, nothing specific in regards to Ward 1. Definitely as a large, don't know if this is an option, but wanted to bring up, I know earlier we were talking about dementia Alzheimer's. There is already a community action group involved with the Alzheimer's Association and the LaRuvo Clinic in regards to Dementia Friendly Nevada, and there is a Clark County group. They meet once a month, so it is a great opportunity for us possibly as a ward to get more information out to each of our wards to how we can help those living with dementia Alzheimer's. We are in the current items of working with our strategic plan and what that may look like as a whole, as a community, to help bring more awareness to those with this dementia Alzheimer's. Thank you.
Thank you. And Ward 2, we have Vito.
Yes. I attend the usual monthly meeting at the Veterans Memorial Center, and it's a good venue to share information and really get to meet the seniors in the community. I would say about 90% attendees are seniors there, and the councilwoman is present there also, and she usually invites an area commander, and it's a question and answer sessions held, and it's very informative. Concerns, usually the concerns are traffic, usually homeless, and some home invasions, depending on what the news brings in the area. But it is definitely worth attending those meetings. And again, some of the concerns have been, not necessarily, but there have been situations with energy cost and repairs for the air conditioning systems. And with that in mind, I had a senior who was living for the past 2 weeks with about 6 fans in the house because she had called the repair service and told that it would cost $15,000 to repair her system completely. But she went to live with someone else in the meantime, and I had the opportunity to talk to her, and I said, well, is it possible, did you really get a second opinion? Because usually, I would say about 80% to 90% are capacitors, which are about $15 to $25 to replace. Again, that brought on a concern saying, well, perhaps there should be more education for anyone, actually, but for seniors especially, because they become very vulnerable, and to or at least the upkeeping of these systems are vital in Vegas, And that could be a presentation. I'm going to try to reach out again to the local libraries because it will attract. And take, there are ways that you can inexpensively save a lot of money when you get that $29 or $39 yearly inspection. Just don't commit yourself to it. Just ask them to make the list and say, and ask for the capacitor. How much life do I have in that? Usually that brings the price down a lot. So that has been the main focus, and hopefully I can get that through because it is a concern. Only a few people have, but then usually it's that way. It's an iceberg situation. A few people speak out about something, but you know there are a lot of more that are facing the same issue. Thank you.
Thank you. And also for Ward 2, we have Yvette.
Yes, Yvette Weinstein Hall, Vice Chair. The problems that Vito just talked about are in a more affluent area. However, there are areas in Summerlin as well as in other wards, again, where there is, again, isolation. They call somebody, and again, that particular person is trying to bamboozle them. Again, family members aren't aware necessarily of what's going on. A lot of seniors that are mobile are embarrassed to talk about these things. I have run into people in the supermarket, and they really are embarrassed. So again, it goes to isolation. It goes to fraud. It goes to understanding about phone calls in the middle of the night that can be alarming to seniors. And these are the things that I'm trying to address as well. And these things are pertinent to every ward. It has all of this. It's not really the financial ability of these people. Again, it's the isolation, the bamboozling, and the necessity of consent. So that's what I've been finding and been talking about. Thank you.
Thank you.
Gregory Gray for the record, Madam Chair. When hearing what Vice Chair is talking about, again, this is another opportunity for you to reach out to your community. If you are doing things on a consistent basis to where, like, for example, if Vito is partnering with our neighborhood outreach team to go to a local coffee shop to have a talk with seniors, and it's happening once or twice a month, and as Yvette was saying, that seniors are uncomfortable or they're embarrassed, but if they know that Vito is going to be at the coffee shop every Saturday, then I feel more apt to go. And even if I just go, I'm just observing, I'm seeing how it is. I see how Member Galati is interacting with other seniors, and he seems to care, he seems to be involved, he seems well informed. I may feel more comfortable talking to him about what I'm dealing with, and then creating those spaces of comfortability and security to where we are able to have these conversations and be able to get them in touch with the right person, services, and resources. So just keeping that in mind as you guys are thinking about this as you're out in the community.
And Gregory, I agree with you wholeheartedly, and this applies to every ward that in the city. I mean, these are the same issues. There may, but some the financial issues may be a little different, or the housing situation may be a little different. But again, there's a lot of pride. There's also a lot of, you explained about somebody that really didn't want to move. Well, maybe you have to explain that this might be a resolution. But anyway, it's a difficult thing to do, but by our presence being around the various areas will help this. So thank you again.
Thank you. And Ward 3, we have Jennifer.
Hi, I'll just be super brief today. We have some good news from Ward 3. We had 60, the Golden Rule senior apartments opened, and they opened with 60 affordable housing units available for our seniors. So that was great news, although they, we need more than that, but it's a start. They're going to be doing a second phase, which it's in the works. We don't have dates yet, but they'll be adding 60 additional units to that apartment building, which has a food pantry for the seniors, and that was great. And I am so sorry, but I am doing double duty today, and I have to be here now with my niece for high school orientation. So do you mind if I drop now so I can attend to her?
No worries at all. Please attend to her. It will not affect quorum, and we will get more of your report on the next one. Thank you.
That is perfect. Thank you.
And Ward 4, that is myself, Deanna Rear Cameron. And I'm going to kind of touch base on, I guess what you would say, more of the chair-worthy type things. So I did have my my Commission on Aging meeting this morning, and a lot of the things that we're talking about are being talked about on a state level, which is beautiful because we'll start seeing more integration. And I got some commitments on that very thing today, which really pleases me. And they were talking about the same thing. You know, we're going to start looking at housing and dissecting it, which I will bring all of that information to, you know, Jocelyn and Lindsay and to all of you as it comes through. And for anything that comes through as a PDF or a document, I can share it as long as it's been made public on, you know, the state site. And they were talking about also, you know, the SNAP Ed, which is, you know, the food program, SNAP. And that a lot of seniors, for whatever reason, have been left out of that. They're seeing that we are not getting the, you know, diversity, equity, inclusion just on older adults. And so they want to see more of that. And that goes in hand with what we're talking about doing as far as outreach, getting that information, the resources and everything out there so that it can be utilized. A lot of the things that we're talked about is there's pretty much wait lists on all services. And that's across, you know, city, county, state. So what that means is when we are helping someone by giving them information to turn into adult protective services, they're, you know, they have a specific amount of time that they will get to the people, but then it could go in a waiting zone because of the fact that, believe it or not, I just got these numbers from her today, 64% vacancy they have of social workers. So if you're wondering why some of those calls, you know, when you're telling them to call and then they get back to you and they say they haven't had a call or whatever have you, that's a huge problem right now across the board when we are looking at ADSD and APS. Sorry for all the acronyms, but be here all day if I say all of them. But they all have vacancies, right? They're trying to fill these vacancies with staff for social workers, et cetera. So when you look at the graphs and you see the budgets there versus how many caseloads they have and how long it's taking to get them done, that is one of the challenges that we have right now. People are waiting for these services, but they are trying to get the resources in between that, which is beautiful because we have that now at the city where we're getting more resources and outreach and everything, so that I think it's going to start really making a difference, but it takes time. It takes so much time, but I wanted to make sure everybody knew that most services have wait lists, just like Rebuilding Together. And, you know, we never know at what moment all of a sudden someone's going to call back and say, well, they just said they have no more funds. So remember that when you're referring them out, that we don't know for sure that they're going to have that or that a person qualifies depending on what their needs are. We were touching on shared housing. I see that a lot in Sun City, in my ward. So there are a lot of them when I'm out and about that will, and even in the grocery store, I talk to them so much in the frozen aisle this time of year. And it's amazing to me how many of them say they're looking for a roommate or they just got a roommate. So it occurs to me I need to have like a coffee there and bring them in. I want to know how they're doing it within their own community so successfully. It really just occurred to me to do that. So just little creative things like that that we can do. We were talking about, you know, the programming of the senior's mind and isolation. That's another conversation that's being held, you know, on a state level as well, because that falls under mental health. The reason their isolation is happening is because, you know, their behavior is that it's unsafe out there, or nobody can help me anyway, or I don't have someone to help me. These are the things that I hear on a daily basis. And I know Gregory and I were just working on one where the family was calling from out of town, and they were concerned about his his air conditioner not working. And she was offering to pay for it, but he just didn't want to do anything. And so we're trying to reach out to these people, but without that consent that he was speaking of, there's not a lot that can be done. So we also want to keep that in mind, you know, and it really dawned on me after that when we're having, you know, the hottest July on record, that's really no different than East Coast, where they have snowstorms and everyone gets isolated. It's isolating our seniors. They cannot tolerate the heat with some of the medications, some of the diagnosis, things like that. So, you know, I'm getting a lot of that when I'm talking to various seniors and getting the different calls from families or friends that are concerned because they're not coming out. They don't know if they should call because they don't want them to get mad. You know, I mean, there's just so many discussions and conversations. Also, I wanted to let everybody know, I did find the survey that I was talking about. I forgot to make copies. I will email it to you that we used at Ward 4. It's just a short one that you can use. I know we do have longer surveys that have been used, but this is a short one. I'll email it to you. The word maps, want to follow up on that if we can, please, Gregory, from our last meeting, so we can get those that Caroline brought up. And also the departments list. You know, I know we can go through you, but if, you know, there's anyone else that we should have connections to, if we can get that put together, or if you want it directly through you all the time.
As your liaison, that's my job, so please just direct it to me.
Okay, perfect. So everyone heard that, right? Direct it all to Gregory. Just making sure we're clear. And then also, I'm going to skip a lot of the other things I had, and then I'm just going to go to an event that is coming up that is going to be really great. Senior Citizens Day. National Senior Citizens Day is August 21st. Why they made that in the middle of summer for seniors, I do not know. But there is a great event coming up, and it actually is falling in Ward 1, so I'm going to give out these, and I do have one for the record for our city clerk. And it is a rock and sock hut, but it's going to have a lot of resources there. So there will be vendors with all different resources, et cetera. It's being sponsored by Aetna, and it's being put on by Spotlight Senior Services, which some of you are familiar with because of her work that we honored her for the board, and also through the National Aging in Place Council. So there will be information and resources. And maybe if the city wants to have a table there for some information, I can make that happen. I'll talk to them so that we can get out there. And I encourage all of you to come, because this is an event that is going to have seniors from all areas, not just over there at the Heinrich YMCA. So for everybody, that's August 21st. And we will have it on record for those of you that may be listening to this after. And for the sake of time, I will stop there, and I will move on to Ward 5. Charles.
Hi. My issues come from the Doolittle Senior Center. They are in the process, maybe in the next couple of months, of doing a makeover there. But the front entrance is not being included. And they have a single door entrance. And they would like to see double doors there where you could have better access to people with mobility problems and wheelchairs and stuff like that. So that's one of the issues, because like now it's hot and you have 6, 7 people coming in and they're standing out in the heat waiting to come in. So they would like to see, you know, a double door entrance there opposed to a single door. No, that's it. Okay.
Just wanted to make sure I didn't want to interrupt if you still had anything else to report. Thank you, Charles. That is a big one, because the scooters and walkers, et cetera. And next we have Ward 6, Caroline.
Thank you, Madam Chair. Caroline Mosdeen, Ward 6. I'm going to just do a quick look back. First of all, I'd like to thank Gregory for sending on this On the Block Department of Neighborhood Services newsletter. If anybody had the opportunity to go through it, it's excellent, and of course it does cover the homeless initiatives, the health and wellness team, and it was really nice to see a breakout of who's who, kind of, even without the names, the departments or the groups that are available out here. So I thought that was an excellent newsletter, and I look forward, hopefully, to be getting more of those. Or let me know where to sign up, because I'm a newsletter person, as I've told everybody before, and it's my opportunity to remind anyone listening in. Don't forget to sign up, go online and sign up for the newsletters for your own ward and for other wards. There's a lot of great information out in the newsletters. And you can always unsubscribe if you find it's not what you want or you're getting too much. So please go ahead and do that. But as I look back in Ward 6, our Councilwoman Nancy Bruni had a 150 days update, and it was an excellent evening. Not as well attended as I think any of us had hoped, but and it was for all ages. But the great thing was she had the opportunity to bring a lot of city departments out to let people know. Once again, it's information, information, and more information, and repeat it over and over. To have these different departments come out and say what it is that they do, where can they be of help, how to reach them. All of those bits of information are so important to people. So I know that the people that attended very much appreciated that. So thank you to our councilwoman, and I'm sure those kinds of meetings are happening over many other wards as well. We did have lots of activity, even though it was hot. The pop-up recreation in some of the parks. Pop-up recreation is excellent. It's great for seniors, even though it's not necessarily targeted for seniors. But seniors get a lot of benefit, even if they're just out there watching what the kids are doing, whether it's a little race that they're doing or a little activity or hula hooping. Even if seniors aren't doing it, they're getting a stimulation. And I encourage people to keep an eye out for the recreation, the pop-up recreation, as that continues throughout the rest of the summer. And I know something that's happening in other wards as well, but I can mention it that on August 17th, Nancy Bruni, our councilwoman for Ward 6, is holding a legislative town hall. And this is really important because as state laws change and adjust and all of those kinds of things, it has an effect on people. And many people aren't even aware of some of the changes. So it's nice to see these legislative town halls after the state has finished up with their processing. So be on the lookout for legislative town halls in Ward 6 on August 17th, and in other wards, if you can't make the August 17th, many of the other council folks are doing something similar. So thank you.
Thank you. And actually, the legislative is going to be Ward 4 and Ward 6 together at the Technical Center on Centennial Parkway. And that is really, really important. I just want to add, because there are a lot of legislative things that passed, too, that didn't pass that we were really wanting, that do affect our older adults, including things like prescriptions and just different things in healthcare. So it is really great to hear from the legislators themselves when they're talking about these things that did pass. So I highly encourage even other wards, if you can get there. Once again, transportation, I know. But even for the board itself, to come on over to that one, because that one is going to be very informational so that we know what got passed and what it means to all of us as older adults. Thank you, Carolyn.
Additional from Carolyn. Can I make one comment? This is Yvette Weinstein Hall. You talked about these pop-up type of recreation and where the little kids are and the seniors are looking at that. I've talked about mentorship programs with young people and seniors. I think that's something that could really help, help the young and the old together. So that's one of my things that I'm trying to start in Ward 2 as well as elsewhere. Mentoring is very, very important. seniors need to be around young people, and young people need to be around seniors. I think that's very important. So sorry for interrupting. Thank you.
Caroline Mosdine, Ward 4 again, and thank you, Yvette, because that is very, very important, and it's something that should be stressed over and over again. I would like to just add one thing with 2 flyers that I have that are available to all the other wards as well. These were handed out at that 150-day meeting that Nancy Bruni held, and they come from FEMA. And as we get into some rainy season, shall we say? I mean, we had a heck of a storm the other night in Ward 6, but there were 2 things that were handed out, and one is called Take Action and Prepare by FEMA, and it has 12 steps to prepare. So these are very important steps that all families should be aware of, and neighbors should know to look in on seniors as well. So I have a couple of these. I will be happy to hand these out or get hold of more for the rest of the group so that they can hand them out at their locations. And the second was recommended items to include in a basic emergency supply kit. And again, it's a list of emergency items that everybody should have, and particularly, again, seniors, because they're a little slower in moving, want to make sure they have access to these items as quickly as possible if there is an emergency that they have to relocate. So we do have some things that were put out by FEMA, and we can get hold of them for our awards for handout to our seniors. Because as we know, seniors do like little papers with all kinds of great stuff. Thank you.
Thank you. And also for Ward 6, we have Elizabeth.
Elizabeth here from Ward 6. I really do not have much to share, except I met with Mr. William Stein. He is with Americans Heroes for Hire. He's a veterans. He happened to know you, Ms. Chair. And he was telling their project, or they will be offering services mainly for seniors on an affordable or better prices, so they can be reached out. So I was happy to meet with him. Yeah, that was the only thing, because everybody was talking about expenses or cost, but they are more on a volunteer base or a cost-effective base for especially seniors. They'll be watching for us. And thank you so much, that's it.
Thank you. Item number 9, discussion for possible action regarding next steps and future meeting topics of the Senior Citizens Advisory Board, all wards. I know we have had some previous discussions on some of the topics we wanted, and for some reason it's escaping me right now. I guess I could go through the minutes if everybody has a minute. But Gregory, do you recall some of those speakers that we were talking about in our last meeting? I feel like it was so long ago already.
Madam Chair, I think that we were trying to outline like what topics we really wanted to bring forward for senior services before we settled on anything in particular. So I know that the topics that you mentioned in discussion with Jocelyn were among the discussion. Just based on the conversation, I would say like, you know, shared housing, Member Mosdine brought up emergency kits. We actually have an emergency team that can help present on that as well. So we have opportunities to bring people for a presentation speaking.
Chair O'Rear-Cameron, how does everybody feel about what Gregory just stated? That based off of our conversations today with what we've heard with Jocelyn and all of our feedback, making some of our upcoming meetings based on that with the people we've all been discussing. How does everybody feel about that? Any discussion?
Caroline.
I think that's a great idea, Madam Chair. Bill Weinstein Hall.
Caroline Mosdine, Ward 6. I agree. I think that's an excellent idea. And I think in keeping with that, as we get a speaker, even today's speaker, we should kind of all focus on one aspect so that we can once again try to keep our mission statement, what we were planning to do, what we've spoken about over the past few meetings, really, because we've this, even as Jocelyn explained before, this is just such a broad any of these are such broad issues that when we all go back to our wards, I'm thinking about one area, Vito's thinking about something else, somebody else is focusing, and then we get back next month and we've just got little bits and pieces and we just kind of toss them around. So I would like to say, if we take some of the things, or one of the things that Gregory has just suggested, and maybe focus in on it, maybe even one of us takes the lead and says, okay, I'll put together a 10 question questionnaire, pass it to the rest of us. We can focus on that one issue and say, okay, now I've talked to 10, I've talked to 100 seniors in my area, and here's what I came back with. Maybe we can try to keep our focus better, and I think maybe we can get more accomplished that way. So if we can maybe take a look at the list that Gregory just gave us and decide on one, I think it would be a big help if everybody else agrees.
Gregory, for the record, I just wanted to clarify that, just based off the discussion today, those were some of my recommendations. But kind of circling back to what Jocelyn was saying before, that as you are engaging with your community and seeing what's going on with your seniors, you'll have a better idea of what you want to bring forward for the board for presentation and speaking. So I would say that, I think that, based off of our conversation today, we do have a topic or two to bring forward for the board to listen in on. But as you are engaging with the community in those opportunities to educate your seniors or to touch base with your seniors, you become more well-informed about what is important in your community and what you would like to see bring forward to the board as a whole. And that way, you're not only helping the board, you're also informing senior services and how the city can move forward in implementing programming, resources, activities, what have you, to help address some of the issues that you are hearing in the community.
Chair O'Rear Cameron, on that note, there's two things that I really gathered with Jocelyn, and that's listen. First of all, listen. And listening is one of the most unused skills, believe it or not, in human development. And I think that that's huge, because when we listen, it will become what the focus is. Because then we're going to hear, and we're all going to have something different in our wards. And then I think we're going to figure out what's the same in the wards that maybe we can really wrap around. I think that might be helpful as well. Because I know the west side is completely different than the east side as far as needs is completely different. So I think keeping that in mind at all times too, and maybe even, the wards, 2, 4, and 6 might have one mission, and 1, 3, and 5 might be working on this. Not that I'm saying we're, separating our focus, but it's almost like the same as subcommittees, right? You have those two, and that way we're not going too far astray. And definitely, making sure that we're hearing from them and getting out there as much as possible, whatever that means. And I'm here to help, as I've said before. I will be starting up all of my aging in place education again when it's not so hot. I do not prefer to bring seniors out in the heat. It's just my heart. So starting back in the fall, I plan on doing that. And I think that it would be great if we partner and get out there and ask these questions, and maybe even rather than looking at surveys that have been used in my ward or that Gregory and I had when we were doing some projects, maybe we can look at a survey together with Jocelyn and Lindsay, for the outreach and the people who are coming up with this strategic plan, so that we can have a more focused survey on what it is you're wanting to hear as well. I know we want to hear everything, but as Caroline mentioned, that could be really interesting. We could be going all over the place with the shopping cart list of things. So I think it's wonderful, though. And starting off, I know with the shared housing, just quickly during the pandemic, Gregory and I listened to a lot of shared housing presentations. And what it always boiled down to was the city was going to take the brunt of it. We were hoping somebody had that, miracle that, they were going to do most of the work, and it just didn't work that way. So I think it's wonderful if we get the county in here so we can hear more about what that is and what it looks like, so that we I don't know, somehow can help and assist in that, because without programs like that, housing is definitely going to continue to be an issue because it's so broad. So I think that's a really great speaker to really start with.
I just, as you bring out some interesting points, something came back to my mind. Several years ago, we had I believe it was the city of Las Vegas, the master plan. I was wondering what ever happened to that, because primarily is inclusion, senior inclusion to that. And the master plan that I see is now, having been here for 4 years, is transportation, services, accessibility. And seniors will thrive if you have those things. And inclusion means that you don't isolate seniors and put them, or any groups, is include them in the community. And I think we should at least follow it and see what is going on with it, because I haven't heard anything at all. And it affects new communities are developed. And I think a voice should be said at that time, not later. So we should look at it and at least ask questions and possibly make local officials and from there, even the state officials, aware where are the seniors in this plan. Or they are there, but what are we doing about it? I think we should focus on that and not let it ride.
Carol?
Gregory Gray for the record, I'm sorry. So again, I see an opportunity to, if you are not 100% informed on the master plan, there may be others that are not as informed. So rather than, keeping it isolated to the board or bringing planning in, we can touch base with our planning department, who has been doing their own outreach in the community. There may be ways to partner or collaborate in that space to engage with the senior community. That way, once again, you are representing seniors in your ward, you're bringing them information, and you're connecting with them, and then you're able to report that back to the board and possibly have a presentation from planning in regards to that as well.
Caroline Mosdeen, Ward 6. Since our, again, our objectives have kind of changed and been focused over the past couple of months to something that we haven't really done a heck of a lot on, I'm going to ask if there's a possibility that we can ask Jocelyn via Gregory, for each of these teams that are listed, the 5 teams that are listed, is there a possibility to get us started in a mindset to come up with, say, 3 items from each of these teams, 3 questions that would be a questionnaire, so it would be 15 altogether. If we could have that we all focus on for the next meeting or whatever time frame we choose, if we can just start that way, I think in the future we'll be able to come up with our own questions and do it ourselves. But again, I think it seems to me that this is kind of the first time that we're really initiating a different strategy. And following up on Jeff and on Councilman Knutson's suggestions, I'm just kind of thinking that we could still use that little bit of a kick and that little bit of guidance. So since your department is more really familiar, can you focus us on 1 or 2 or 3 of the questions that you'd like us to ask, if that's at all a possible suggestion?
Absolutely. I definitely feel that we are in your corner. We're here to support you. And this is by no means saying, like, we're not throwing you in the deep end of the pool and saying swim. Basically, the suggestion, the recommendations that are made by my team as well as myself is always, guidance, and that if you ever need support, and when it comes to setting up outreach events, we have a whole outreach team that is available to you. I, as your liaison, am available to you to help you and support you in any way. I would not expect you to handle these type of events or opportunities on your own. I would be by your side and be able to guide you in that respect. I am remiss to say that, yes, we can come up with, questions that you would want to answer, but I think that, and I think Deanne can attest to this as well, is that no one goes according to script. It's always like off the side somewhere. So as much as we would like to like hone in on specific questions or niche questions that would be helpful to help guide, you know, you gathering information, I think that once you start engaging with the community, you'll see that they will speak for themselves and they will tell you, like, this is what's going on with me. But whatever you need, we are here to support you.
Chair O'Rear Cameron, that was perfectly put, a guide. And I have to say that colors presentation just showed itself right now. Isn't that amazing? Because she just said over here, I just like my structure, which is beautiful, and he's going to accommodate you in a guide for that structure. And that's what I love about what we did. That was amazing, because you can see how it helps all of us, because I'm looking at her and I'm seeing that color, right? And I think it's just great. So thanks for all the support that you have given to us, Gregory. We greatly appreciate it. And then before I move on to the citizens' participation, I didn't know he was going to be leaving early, but I think all of us here on the board already know that our assistant city attorney, Jeff, who has been so supportive, been so supportive of this board for, I think it's about 5 years. We had Val, who's with us today, and then Jeff came in, and they literally just swore him in yesterday, as our newest city attorney. So we are so pleased about that. I unfortunately get the feeling we will not have him at our board because he's going to have bigger duties. I'm not sure of that yet. I have no idea, but we do have Val, and Val has been a big support to us in the beginning as well. So thank you, Val, and also big congratulations to Jeff. We're so very happy for him.
This is Yvette Weinstein Hall. Hello, Mr. City Attorney. We're very, very proud of you, and thank you for everything that you've done, and we hope that occasionally you'll come and join us at a meeting if you have time. Thank you so much again.
I love it. And item number 10, citizens' participation. Public comment during this portion of the agenda must be limited to matters within the jurisdiction of the board. No subject may be acted upon by the board unless that subject is on the agenda and is scheduled for action. If you wish to be heard, come forward and give your name for the record. The amount of discussion on any single subject, as well as the amount of time any single speaker is allowed, may be limited. Seeing and hearing none, our next Senior Citizens Advisory Board will be Thursday, September 7th of 2023, 1 p.m. here at City Hall. We are now adjourned.